Hi everyone, this is Atishwari Selvaraj. Today we are going to look at a case study on rheumatoid arthritis in young adults. The patient is a 20 years old female. The patient has been brought to the hospital due to muscle pain, limb joint swelling and mild fever. The patient has complained that the muscle pain started 5 days before the admission. Patient do experience some stiffness on the upper arm, shoulder, wrist, knee, ankle and foot. And patient have been met with road accident 7 months before with no severe injuries. Patient's blood was drawn for laboratory parametrical studies. The imaging report, medical history and treatment medication informations were not obtained due to the hospital policy on patient personal data protection regulation. Let's look out and discuss on the lab findings. Looking at the full blood count, patient's MCV, MCH, WBC count and platelet counts are within the normal range. The patient's RBC count, MCHC and hemoglobin levels are lower than the normal range. It indicates a mild anemia in patient, while the ESR value of the patient is higher than the normal range. HbA1c of the patient falls within the normal range, while the CRP range of the patient is quite high and indicating the presence of inflammation in patient. A latex test was done to indicate the presence of rheumatoid factor in patient. The RF is positive at titer 1:128, which is very high range for a 20 years old young adult. Taking note on the road accident met by the patient 7 months before and no positive rheumatoid arthritis history, it can be deduced that the patient might have been experiencing a post-traumatic rheumatoid arthritis. As stated before, the patient's low RBC count, HP level, hematocrit level and MCHC level, the patient might experiencing a mild anemia due to the loss of blood due to the accident 7 months before, and some studies have proven that the patient with post-traumatic rheumatoid arthritis might experience some mild level of anemia. The elevated CRP and ESR levels indicate the inflammation in patient, yet these two parameters will not solely serve the positivity of rheumatoid factor, yet a positive rheumatoid factor along with CRP and ESR elevation will provide a positive rheumatoid arthritis, yet imaging reports and other medical reports will support the positivity of rheumatoid arthritis in patient. The treatment for rheumatoid arthritis involves two types of drug: no steroidal anti-inflammatory drug and disease-modifying anti-rheumatic drug. NSAID serves as rapid-acting first-line analgesic and anti-inflammatory drug and do display a variety of modulatory effects in vitro. Although NSAIDs are incapable of suppressing the immunopathogenic mechanism and altering the progression of disease, yet it is clinically proven that the patients who have been treated with NSAIDs exhibits a decrease in the number of activated T-cell B-cell circulation along with a depletion in ESR, CRP and RF levels. A symptom observation and symptomatic treatment are vital for the patient with post-traumatic rheumatoid arthritis, since the physiological and psychological alteration of patient might induce the activation of autoimmunity, and the CRP, ESR, RF levels do have to be monitored after the therapeutical treatment in order to reduce the physiological effects of patient in long term. Thank you so much for listening. Have a great day.